Aversion therapy is a form of behavior modification used to help people with unwanted behaviors such as substance abuse or compulsive eating. It works by associating an unpleasant stimulus with a maladaptive behavior to reduce its occurrence. It is based on the principles of classical conditioning, where a neutral stimulus is paired with an unpleasant stimulus to create a conditioned aversion or negative response towards the target behavior. In aversion therapy, the individual engages in the behavior they want to change and then experiences an aversive stimulus shortly afterwards. This could be a noxious odor, an electric shock, or an unpleasant sensation. The idea is that the individual will develop a negative association between the behavior and the aversive stimulus, decreasing their desire to engage in the behavior in the future. While it can be helpful in some cases, critics argue that it can be unethical because it involves deliberately causing discomfort or pain to an individual, and that it may not always lead to a long-term behavior change. Aversion therapy is often used to treat addictions, compulsive behaviors, and paraphilias. While aversion therapy has been used to treat a variety of conditions, it has also faced criticism, including the following concerns. Ethical concerns. One of the significant criticisms of aversion therapy is that it can be unethical. Some argue that using punishment as treatment method may be cruel and degrading and can lead to psychological harm to the patient. Limited efficacy. While some studies have shown that it can effectively reduce certain behaviors such as addiction, other research has suggested that its benefits may be short-lived or insignificant. Lack of generalizability. Critics argue that it may not be generalizable to real-life situations. For example, a person undergoing aversion therapy to quit smoking may still crave cigarettes when the aversive stimuli are absent. Potential for abuse. Some experts have expressed concern that this approach may be used as a form of punishment or coercion rather than as a legitimate form of treatment. Below are examples of aversion therapy techniques. Discuss inducing substances, which are unpleasant or nauseating substances which are utilized to create negative associations with behaviors or habits. Electric shock. Therapists can utilize mild electric shocks to create negative experiences associated with particular behaviors. Foul odors. This aversion technique uses unpleasant or foul odors to create negative associations with certain behaviors or habits. Negative imagery. Vivid, disturbing, or repulsive images are utilized to elicit negative emotional responses towards behaviors or habits. Social consequences. This technique employs social disapproval, embarrassment, or negative feedback from others to create aversive associations with behaviors or habits. Cognitive framing. A cognitive technique which changes the perception of behaviors or habits from positive to negative. Punishment. Behaviors or habits may be discouraged through the imposition of negative consequences such as loss of privileges or fines. Time out. This technique uses isolation or separation from a desirable environment or activity as a consequence of behavior or habit. Taste aversion. It creates an aversive association between a particular taste or food item and a negative experience. And nausea-inducing method. The use of techniques that induce nausea or discomfort to create an aversive association with a particular behavior or habit. When utilizing aversion techniques, it's important to ensure that the strategies and methods are ethical and appropriate. To learn more about aversion therapy, check out our guide on our Carepatron platform in the link in our description, or check out our guides playlist for more information like this. Thank you for watching our video at Carepatron. If you enjoyed this video, give us a like. If you would like to see more videos like these, subscribe to our Carepatron channel, or click on one of our recommended videos.